Trump, friends, is astonishing with his directives aimed against migration and migrants. Here is a new directive from the President of the United States, his latest order. A new directive from President Donald Trump's administration may make it more difficult and challenging for foreigners with certain illnesses or medical conditions to visit or live in the United States. These illnesses, such as diabetes or obesity, or for those who lack the necessary financial resources and assets to support themselves, may now face additional barriers. In other words, this directive instructs staff at U.S. consulates and embassies abroad to conduct a thorough and comprehensive check of applicants for entry visas to the United States to ensure that they can demonstrate they will not have to rely on government assistance after entering federal territory. In principle, even now, federal American law already requires individuals who wish to obtain permanent resident status or legal status to prove to the American authorities that they will not become a financial burden on American society and, above all, on American taxpayers. That is, that they will not receive any benefits or subsidies from America. During his first term, Trump expanded the reasons and grounds on which such applicants could be denied permanent residency or any other legal status. But this directive, this order, is new and has gone even further. It is aimed at people who are overweight and those with diabetes. It is clearly stated in it. Trump is doing all this, of course, to reduce migration to the US. In other words, he wants to filter people out this way and give consular workers grounds to deny all these visas. Julia Gillette, Deputy Director of the U.S. Immigration Policy Program at the Migration Policy Institute, said the following: "This could lead to a significant reduction in immigration. Immigrants wishing to enter the United States already undergo a medical examination by doctors approved by U.S. embassies in the country where they reside. These people, candidates for visas and entry into the US, are currently screened for various infectious diseases such as tuberculosis and other infectious illnesses and are asked to report any instances of drug or alcohol use or if they suffer from mental disorders or have suffered from them in the past, or if there have been any incidents of violence, aggression, and so on their part. That is, all of this must be indicated in the application form. All of this is double-checked. They also need to get a series of vaccinations which will be specified by the consulate staff. So everything is strictly followed and checked there. And the new directive clarifies the requirements. It states that consular officers must now, according to this directive, a number of specific details about individuals applying for a U.S. entry visa must be taken into account. They must provide information about themselves and collect information about them. This includes age, health status, marital status, financial situation, what education people have, and what skills they possess besides their education. Whether they have used any kind of government assistance anywhere in any country in the past, regardless of where they lived or what citizenship they hold. For example, if someone was a citizen of Ukraine but lived in Germany and received Bürgergeld, and now decides to go to America, they would have to indicate that they received Bürgergeld in Germany. The directive also states that consular officers must assess the applicant's level of English proficiency. They do this by conducting the interview in English with the applicant. So now, during the oral interview, consular officers will make their own notes at their discretion. In other words, it will be a subjective judgment of how well the person speaks English. You see, they will probably have some kind of scale or grading system by which they will determine all of this. Now, immigrants who have chronic conditions such as obesity, high blood pressure, cardiovascular diseases, metabolic and neurological disorders, depression, anxiety, as well as mental health conditions that may require treatment costing hundreds of thousands of dollars, as they write, will most likely be denied an entry visa to the United States. Of course, when this document was published, it immediately sparked a lot of criticism and outrage. Why? Because now relatives will not be able to visit their family members who, for example, already live in the US, since many people, let's be honest, are not healthy. Especially after the age of 45, almost everyone has some kind of chronic illness, and accordingly, this will be a reason for denial and refusal to issue them a visa. And accordingly, there was also a lot of criticism from human rights organizations saying that this shouldn't be done and so on. And the State Department representative, Tommy Pigott, responded to this criticism as follows. The Trump administration puts the interests of the American people first. This includes implementing policies that ensure our immigration system does not become a burden on American taxpayers. In other words, they don't want to let freeloaders into America who will then go on welfare. That's all there is to it. You know how doctors joke? There are no healthy people, only those who haven't been fully examined. In general, many people, especially after the age of 45, have some kind of chronic illness. High blood pressure, diabetes, these are very common. Nowadays, diabetes is said to be affecting younger people, even appearing among the young, and so on. So that's the news, friends. What do you think? Is it right for Trump to implement this kind of policy? Now, basically, every other foreigner can be denied entry to the United States. Please share your opinion in the comments.